Always had kind of a knack for science growing up and was really good with people, and so tried to find a nice combination of those two things, and medicine, more specifically orthopedics, was kind of a natural draw. The focus on really what drove me into going into adult reconstruction or hip and knee replacements is essentially giving patients their quality of life back. Taking people that used to be active or are still active and doing so with pain and helping them get back to walking their dog, playing golf, swimming, just basic things that people take for granted, and that's been the most rewarding thing about our specialty. When I see a patient for the first time, my goal is to kind of just hear their story. First of all, listen to them and figure out what their goals are, what are they trying to get back to, what are they not able to do on a daily basis based on their hip or knee pathology, and then really just kind of take a look at their x-rays, watch them walk around the room, examine whatever joint they're coming in for. I think it's important to know that I don't treat x-rays, we treat people, and so kind of treating them as a holistic and not just as a joint, a hip or knee problem is the best way to get them moving forward without pain and getting back to their daily lives. The most important thing is this is elective surgery, hip and knee replacement, and so I always tell my patients, I don't tell you when the time is right, and I never say that you have to have surgery. And so I generally tell my patients, they come in and tell me when it's time. It's not the other way around. And so that's kind of, it tends to put folks at ease and let them know that the timetable is really theirs. And so when if surgery isn't right for you, then we're going to find a way to treat your pain that way. And it's really on their timetable, not ours. The best thing about our job, my job in particular, is that post-op visit. When the patient comes back and says, I'm walking pain-free, I'm back to playing golf, playing tennis, just being able to go for that after-dinner walk with my husband, wife, spouse, and doing so without pain. That's kind of what it's all about.